COVID-19 pandemic and lockdown has led to a number of court cases already. Bhekisisa Center for Health Journalism has pointed out that the South African medical profession has been operating in an environment high in litigation for some time, and the healthcare sector is bracing for possible court cases connected to the pandemic. Aisha Abdool Karim is a journalist at Bhekisisa. She joins us now live. Aisha, good evening. Doctors have already had to deal with some serious worries around malpractice, lawsuits. Now, when we look at the COVID-19 pandemic and just the abruptness with which it has hit the world, is it likely that these are going to increase?
Yeah, so I think, as you pointed out, there is already a huge culture of medical malpractice lawsuits in this country. So there's already a huge problem of doctors being sued. And what's being highlighted, that's just being highlighted now during this pandemic. And we're very likely to see that doctors can be sued for their actions that they take during the setting that we are in right now, because with COVID-19, there are a lot of choices that doctors have to make, and it could potentially open them up to lawsuits. We see this especially because we know that we aren't yet at our peak when it comes to COVID-19. So the hospitals are not yet full. But as we progress, as we start to see more infections, we're going to see more severe cases. We're going to see more people coming into hospitals that need care, that need treatment. And we're also going to experience resource shortages. For instance, ventilators. We know we have a very small supply of them available in this country. And so as we get more sick people coming in that need to be put on ventilators, some doctors are going to have to make a choice about which patients get ventilators and which patients don't, which is something we've seen in countries like Italy, where doctors are having to make these very difficult calls. And if a doctor, because there is a shortage of resources, has to make a call where a patient may not get a ventilator, that could potentially open them up to a lawsuit where they're being sued because they weren't able to provide that care.
Now, of course, sure. Of course, one of the dangers then becomes that doctors find themselves in a position where they're thinking about how to protect themselves against any potential lawsuit. Speak to us about defensive medicine. What is it really?
Yeah. So defensive medicine is basically where doctors are so afraid of being sued that they try to sort of overprescribe different treatments, or they proactively give people care because they're so worried about not pursuing all the avenues and potentially being sued. Why this is a problem is, for instance, if you have somebody coming in and let's say they have a cough, but you have no way of really knowing if it's COVID or if it's not a COVID case, that doctor might then make that patient get a test for COVID-19. They might also have to undergo other tests. They might be forced into isolation, which they might not need. And why that's a problem is that for that patient, it means that that patient got a lot of care. But we already are seeing scarce resources when it comes to testing kits. And if doctors start to overprescribe things, like if they start proactively giving people tests where it might not be necessary, it means that later down the line, there are less tests available when we really need them. So it sort of causes this proactive reaction from doctors that means that in the long run, people's quality of care that they're being provided is lowered and they're receiving less care in the future. It also means that because doctors might be scared of getting sued, they're less likely to come into work. And that means that because people are scared of being sued, we might see fewer boots on the ground coming to help fight this pandemic when we need healthcare workers. They're on the front lines because they're too worried about potential lawsuits that might arise from their actions later on.
Sure. You know, it becomes unquestionable that countries' health systems take incredible strain while trying to fight COVID-19. So I'm just wondering that when people are opening these lawsuits against whatever they think could have been done differently, are we likely to see a difference between the public and the private sector?
I mean, it is difficult to say. I think generally these lawsuits are a bigger problem in the private sector, and it is likely that the private sector might be more impacted, especially because a lot of these resources are in the private sector. For instance, like most of the ventilators are in private hospitals, so they might be the healthcare workers that are forced to make that call. But also, I think it's important to note that, there are regulations in place that means that could change, like private healthcare workers could be forced to go into the public sector, and resources could be moved around. So I think at this stage in the pandemic and in our local epidemic, it's very hard to tell which sector this will be concentrated in, but primarily in the past, it has largely affected the private sector.
All right, Aisha, let's leave it there for tonight. Aisha, Abdool, Karim, she is with the Bhekisisa Center for Health Journalism.